Okay, good morning. This is the Board of Health meeting. We're going to call this to order at 10:01. Thank you for coming. One of my goals becoming a member of the Board of Health has always been to get the truth out. People want good advice based in science, not lies, not vaccines or gene therapies that may not be needed or could possibly do more harm than good. In our neighboring state of Idaho, the Board of Health has actually banned the COVID vaccines. They've completely removed it from the shelves. By the way, that's not my desire, but it does raise concern. Most of Europe and several states in the United States have laws that ban fluoride chemicals from being added to water, to drinking water. The Longview City Council has been discussing the same. Since the pandemic, the public has justifiably lost a lot of trust in our public health systems and is questioning the government's actions and intentions. In January, this coming January, we'll have two new Board of Health members, two new commissioners that will be joining us. And with the overwhelming results of the recent election, both in Cowlitz County and in the United States as a nation, there's a clear mandate from the people now to make America healthy again. My hope is that this board can help. And with that, I'm going to move on to our first order, which is old business, which is to review the minutes from the last meeting. I'd entertain a motion to accept them. Did everybody receive them? And somebody would like to make a motion to accept the minutes?
I move to approve the minutes from the last meeting.
Thank you. Motion on the floor to accept the meeting minutes from from October 29th. All in favor, say aye.
Aye.
Aye. Any opposed? Motion carries. Okay. Second item, the bylaws we passed, we amended at the last meeting have now gone into effect. I just wanted to make sure everybody knows that the new bylaws are now in effect. And I believe they're, are they posted, the new ones? Or they could be, they hopefully will be posted later. But they're now in effect. So just getting it off my list since we passed it. Okay, the next item would be, we discussed a couple times now, the school garden project. So is Gina here? Yeah, hi Gina. Well, welcome Gina to be here, and Ian, okay, you're good. Ian has been working on a school garden. Well, he's had a school garden project for a number of years, and the last meeting, the Board of Health asked that Ian met with Gina, and they have come up with a proposal.
Good morning, Gina James, Health and Human Services. With me is Ian Thompson, is Operations Coordinator and Founder for the School Gardens. From last meeting, we were asked to kind of work together and put together just a short proposal. We'd been talking about the school gardens and potentially allocating some funding to support some of their activities. So Ian and I met and he put together this proposal. I believe it was sent out to the Board of Health members ahead of time. There are some extra copies here if folks in the audience would like to take a look. Thanks, Tim. So you can read through it. I hope you've had a chance to take a look through it. The funding amount is about $150,000. That would support some personnel costs, including 3 full-time garden coordinators and 1 part-time seasonal garden assistant. And there's a quite extensive list of the activities that those positions would help to do, including recruiting and managing the 300 to 500 volunteers that make the school gardens possible, including all of the activities they do with youth. So I'm gonna see if Ian wants to add anything else to this, and then we're here for questions.
Thank you so much. I don't think I have anything to add right now, but looking forward to questions or anything that I can clarify. I guess I do want to say that we're just grateful for to be able to do this work in this place, and just for the opportunity to be able to be here and ask for support. So appreciate being able to have made it this far.
Can you, Gina, maybe just touch on the highlights of it, maybe? Just because I'm sure the public hasn't read it and.
Sure. Do you want to? Do you want me to?
I can.
Okay.
So yeah, we have a kind of a special story of school gardens in this community. 22 years ago, one was started at Northlake by a few parents and teachers that were, motivated to get kids outside, hands-on learning about where food comes from, that sort of thing. And what they ran into is what school gardens run into all over the nation, and I'm assuming the world. Well, maybe not, but anyways, that group of parents and volunteers and teachers that started it, they're not able to maintain it because the parents move on, the teachers retire or whatever. And so every district that we've talked to has the story of some people were really excited. They started a garden, but there was no way to really sustain it. And public schools, for the most part, are not able to do that because they're just it's too tumultuous of a program to be able to sort of sustain that sort of thing. So the communities where it's working, there's a community partner that, recruits all these volunteers, begs for money, and, takes care of these. So that's what we're doing here, and we're having really good success. So we've just reached the point where we have a garden at every elementary and middle school in Longview and Kelso. That's 20 schools. That's a lot of kids, and kids that normally would not have the opportunity to do really simple things like dig in the dirt, plant a seed, harvest something that they've grown, learn to use tools, that sort of thing. And a lot of the mental health benefits that go along with that. They're able to do that no matter what. If they live in a van or an apartment or whatever, they're able to do that stuff. And it's amazing what it does for kids' attitude about food. We have so many times every day, parents saying, how did you get my kid to eat this? My kid will not eat anything green, but once they've grown it and they have a hand in it, it just changes their whole relationship with food and what kind of foods they're excited about. So we just, that's that sort of thing. So appreciate your time. I just want to say that we are at this point where grant applications and donation requests have been a little easier to do because we're always been saying we're building a new garden, and people say, oh, we'll support that. Or a granting agency will say, we'll support that because you're doing something new. And we're at the point where we've built all the gardens, we're kind of done growing, and we just need to, maintain and do the programs, interact with all the students and the teachers, that sort of thing. And so that's what we're trying to do. And we've had a lot of major funders drop off in the last year or two because we reached that milestone, and we're really looking at how do we make this sustainable and have it be a thing that can continue. So that's kind of why we're here today.
Ian, I have a question. When you list, what the staff will do, you list some great activities for those staff. What I'm curious about is, are those new activities, and have you alone been doing a lot of these activities? Because if so, you're pretty amazing.
So yes, and I would just want to point out that we're talking about supporting that work, and for the most part, this is work that has been going on and is currently going on. But like I said, we had a staff member who moved on just for whatever personal life reasons, and because of the budget stuff I was just talking about, we were not able to rehire that position. So we're actually at a lower staffing model than we were for or 5 years ago, or we're back down to that level. So we aren't in a position to sort of say, will you please help us if we do these new activities? We can't do any new activities because we're doing all of these activities. So we're asking with help with what we're already doing.
Got it. So this is funding to replace what has dissipated to continue the work that you've been doing.
Exactly. Yeah,
Great. Thank you.
Ian, one of the great things about the program, from my perspective as retired teacher, is the tremendous impact that you're able to provide school kids, as evidenced by the enthusiasm during the harvest celebrations that you sponsor at the various schools. And it's pretty amazing to realize, first of all, that we do have kids who live at home in a culture that doesn't associate growing things with the food that they eat. And it seems that's more commentary of how society has struggled. And you add a pretty important element to that. The county does do some nutrition programs through WSU Extension. Are you able to dovetail it all with the WSU Extension programs with nutrition? I think the audiences are a little bit different, but I haven't heard if you've been involved with Extension.
We have had a partnership with mostly Master Gardeners, but the Extension over the years. I think a lot of those programs, I don't know if you're considering 4-H to be one of those, but then there's also the other thing where Debbie and Gary Fredericks would come to the schools and do nutrition talks. We've partnered somewhat, but I think that a lot of times there's a structure there that's harder for us to intersect with. And mostly what we do for programs like that is say, you're teaching this thing, here are the gardens if you want to sort of, teach that lesson in a garden or use our resources. So not as much as we'd like, I would say.
Commissioner Weber, what was the name of that program you were just mentioning? The one that
WSU Extension has
WSU Extension?
number of different programs, and Master Gardeners, of course.
There's
Gal right here.
Okay.
And Jennifer is here.
Yeah.
The coordinator.
Please.
Thank you for that. In regards to your question to Ian, is currently, in addition to what Ian said as far as.
You need to make sure the microphone's on. Well, there's a,
Know that because I have to sit on
Thank
the
you.
other
There you
side
go.
in another meeting. Okay, sorry, Kelly. So what we do currently have in the office besides Master Gardener and 4-H, but I think in line with what Ian is saying is we have what's called SNAP Ed program and we have SNAP Ed staff. But it's very specific to families that are struggling financially. So we do have a SNAP Ed coordinator, and we also just put somebody full-time in the Highlands area. And that's been our area of focus. So it has to be a very targeted audience. So, but thanks for thinking of us just as I walked in the door. I hope that helps you, Ian, to understand what we are limited with that nutrition education by staffing.
Yeah, thank you, Jennifer. And there is one point where that overlap happens is the Highlands Neighborhood Association. I think it's on Baltimore. And there's a garden there. And so we help with that garden. And there's one of the free farm stands that we've talked about that's located there. And so a lot of times when we're coordinating, giving away produce or whatever, we're working with the SNAP Ed person over there. That's a way, yeah.
You've probably told me before, how many kids we kind of involved in?
So directly by our staff, it's about, I think it's 4,800 right now, because we're essentially seeing every elementary student,
Yeah.
in person doing activities. But at the middle school level, every student has access to the garden. Their teachers can bring them out to the garden, but we're not there doing programs during the school day. So at the middle schools, we're doing an after-school garden club.
Gotcha.
So that might be total of the 5 middle schools, that might be like 150 kids, 180 kids a year that are going through that
Right.
more in-depth program, but yeah.
And just, so it's clear, with more directed at Gina, this is all suggested that this comes out of this foundational funds that we get from the state of Washington.
Yes, the Foundational Public Health Services
Yeah, and
funding.
I think we have to be, I'm making an assumption that we need to be prepared because it's covering wages and it's covering bodies, that this is probably going to be looked at on a yearly basis. Because I don't see this program generating revenues to cover this, right?
At the last meeting, we discussed making it a possible pilot program. And a pilot program, from what I understood, would be could be renewed, but not necessarily renewed every year.
Yeah, but if you want to renew it, it's going to have to come out of this fund. I mean, we just need to be comfortable with that if that's what you want to do. Just being upfront. Yeah.
Yeah, and we often have contracts that are 1 year at a time. And that gives us an opportunity to revisit at the end of that 1 year period to then make a determination about, do we still have the funding? Do we still want to support this program? And then decide to renew a
Methods
contract.
Do you think would make sense to I don't know,
Yeah, that.
to say, hey, that's money well spent. You know what I mean?
Yeah, that's a tough one with this type of work. We're talking about being involved with 4,800 kids and, and more than that in the middle school and doing, introducing them to activities they may not get to do and different life skills activities. How do you measure that?
Yeah.
Some programs do a pre and a post survey. In my mind, the prevention type activities are hard to measure in that sense. We're not going to be able to say like, oh, X, amount of students showed an increase in whatever we were working on. But the benefit, we know that these kids are being active. They're participating in these activities. They're getting exposed to healthy foods. They're being outdoors, learning how to work with tools. I mean, I think that type of information is part of how we can look at
Yeah.
and see. And I would encourage you guys to go visit the program too.
And
And
I don't necessarily disagree with it. I think this is, just to be frank, this is a lot better than some of the garbage they're teaching in schools. In fact, you could delete probably 2 or 3 classes and this would be more beneficial than some of the crap they teach.
Breaking my poker face.
So I probably feel compelled to be somewhat the odd man out, but let me begin by saying I don't think there's any question this is a great program.
Yeah.
So I think the only question on the table is how do we maintain it? And this has the recipe, the proposal has a recipe that I've seen time and again for how you take something that was driven by the spirits and efforts of a few individuals, and you change it into now a business-like kind of thing or a government business kind of thing. This for me is a problem. I think we will destroy it. Now, most of us have had children and we've helped coach soccer or volleyball and we've grown up with them, but with those programs, but we go away after the kids graduate and all that. I think the only way this kind of program can be maintained is by passing the baton off. Ian's work tremendously improved the concept. but we need a succession that doesn't include iffy funding. And iffy funding itself always causes a problem because it leads to decisions like, I tried to do something with the airport and ESD 112 came in and immediately DEI was right at the forefront. And as soon as you start to take funds from the government, you've got issues where they want control over you. I thought that the chairman had expressed a very useful thought where we would be willing, we in that case was the Board of County Commissioners, to support, let me call it infrastructure, far sooner than we would try to support an organization. This is, again, very typical of you have a nice organization, it's able to maintain itself, even though it takes a pound of flesh out of everybody, but that's where excellence arises from. Too much, I see, people don't think of things other than, oh, for $1, for an hour, I'm going to get so many dollars. And I've never been that kind of employee, but that's the trend we have now. I don't want to destroy that, that effort that you put out. Things to think about might be succession plans. How do you get new parents in? How do you get something going there? Apparently, mom and dads are always happy to help, or are they? I don't know. But in fact, we can't successfully make up for parents who are not interested. Going back to the metrics, the question of the metrics, I have no idea how you go about that. Dealing with young people and is a reality that it takes a long time to see the fruits of that effort. That's why I say I'm perfectly happy to stipulate that this is a wonderful program, but I don't want to destroy it. Let me stop there for the moment.
Someone else. Okay.
I have several questions. Is it correct that basically so far it's all been volunteers? This is the first time you're looking at having paid employees?
No, so it started as a volunteer. When the first garden was done, that was just volunteers. That was, 22 years ago. And then when we started a couple more gardens, that was volunteers, but that, what we saw was this is too much. We got to do something. So we started a nonprofit and we came under Pathways 2020, if anybody remembers those folks and the good work Paul Yeomans used to. So for me personally, I was self-employed building contractor and I was able to get a small stipend to start to do, 10 or 20 hours a week to work towards this. And then in like 2012, we got in with the AmeriCorps program. We had AmeriCorps people. And then anyway, so we've built up. So this is our current, you're looking at our current staffing level and it is less than sufficient to do the work. So we're really scrambling. People are really struggling to do all this work with the few people that we have. So yeah, this is current. So it hasn't been all volunteer for a long time, but the thing about volunteers is that you can't coordinate and manage volunteers with volunteers. You have to have like the stable people that are paid to show up to manage the volunteers. Anyways, I hope that's helpful.
So right now, it looks like you're trying to recruit, train, and manage 300 to 500 volunteers. How many volunteers do you have right now?
This is all current. So that's what's happening right now. So we're not, and I just want to say that I know that an attractive appeal is if you give us this money, we will do these new things and we'll serve this many more kids and we'll have this many more volunteers. And we're at a point where we're trying to figure out how do we actually survive and sustain this thing. And so yeah, that's our current, that's what we're doing currently. So that's how many volunteers we have right now.
Well, I would have to agree that this sounds like an absolutely marvelous, wonderful, functioning, working program. However, I would also ask the question is there a point in time that it grows too big? Because if you're at 160,000 square feet of growing space and you're lacking for volunteers and people to manage it, what size is it too big and out of control? Maybe, and I see you're going to try and recruit this into the curriculum and school life. Wouldn't this be better managed at the school rather than a separate organization?
By school districts?
Yes.
What we have found is that is just not realistic, and not just what we found, but there's whole organizations out there that just think about school gardens. And so we're able to learn from people trying to do this all over the place. And I mean, there are a few like really affluent schools that are able to pull it off, or in a district. Like right now, if we had just sort of let it go to the schools, and even Northlake, which is sort of the flagship, we've been through 5 principals there. And if we had just left it to the school, it would have been bulldozed. So what we'll see is that, like, if we were to drop away, some of the schools would keep it, but it probably wouldn't be St. Helens and Wallace, the high poverty schools probably would not. So we're kind of trying to be the stopgap for that, so that it doesn't matter whether they have a functioning PTO or whether the parents have the wherewithal to show up or whatever. Like, this is just something that every kid gets because they should. But anyways, no, we're trying to increase the partnership of the school districts. But like right now, the budget, like what the school puts into our budget, is less than 5% of our budget from actual districts. So Longview puts in $1,000 per school per year. And Kelso, their public schools foundation, is putting in half. They just started putting in $500 per school per year.
So I guess, do you have a feel for at what point is this program too big?
Right. And I will actually nod to that. When we named the organization in 2010, we named it Lower Columbia School Gardens, because at that point we thought that our mission was to build gardens, and we were really good at that, and it's not that hard, and it's easy to get donations. And so we were thinking Castle Rock, Rainier, Woodland, and what we learned is that, the scope of what just Longview and Kelso, that's a lot to manage. And I will say we have probably grown too fast and bitten off a little too much, just because, a school says, will you please help us build a garden? And it's just been really hard to say no. And so we've just like pushed and stretched and pushed and stretched. And also, I think we didn't see this sort of budget turn coming. We sort of were seeing this sort of trajectory, like slowly. We were growing, our budget was growing, and we were able to add a few more gardens and add another staff, and it was working out. And what we are learning is that appetite for giving to something, by a lot of granting agencies, they're saying, what new thing are you going to do? And so anyways, I think if we were to grow we've reached our cap, basically. Like, this was our goal with the building of the new garden at the new school in Lexington. That's our cap, is just these 20 schools. And it's a lot. And if we talk to other districts and we have people coming to Longview and Kelso, to say, wow, how are you guys doing this? So it is a lot. I will give you that. But yeah, but I don't think it's too much, and I don't think it's worth it. And I think we've had to cut. So Dennis Weber's seen these beautiful harvest festivals we used to do. We've had to cut those. Every kid gets to do cider press and roasted vegetables and jump over the hay bales. We do that traveling road show for every student at all the elementary schools. And because we just chose to add more gardens, we've had to cut some of those really rich programs. So we've like shaved back to what is basically bare bones, so that's what we're looking at. So having a garden that's, functioning and safe, and then having some staff involvement to recruit new volunteers, train volunteers, work with teachers, that sort of thing. And then coordinate the harvesting and giving away of all the food that's growing out there. That's sort of the basic thing that we can't really go under it because the gardens are alive, as opposed to like a program, basketball or something like that, where we don't have enough funding, we don't have enough volunteers, we'll just put the supplies in the closet and we'll pull it out next year if we get, enough. We can't do that with the gardens because they're alive. If that's helpful.
Is this a fair weather project for kids?
Say that again.
Is this pretty much a fair weather project for kids? And it's pouring down rain and the wind's
No,
blowing
you'd be
outside.
surprised. Yeah, the adults, you melt before the kids do. The kids are happy to be out there in the rain. The limiting factor is adults to work with kids, but kids are like, can we do this every day? When do we get to come out again? That sort of thing. So we're working on, having shelters at all the gardens. When we've built a few at Barnes and Huntington, and then we're working on a cheaper version is like the party tent, that you would rent, that you can kind of leave up year round. But so our program season is basically excludes December, January, and February. But aside from that, we're doing regular weekly stuff with kids, even if it's raining.
So when you set up to do the kids learning to cook the meals that they've prepared,
Yeah,
are they doing that in the school? Or are they doing
No.
that, you're setting those facilities? up at each
that's
location?
camp cooking. So we're setting up, we've got the camp chef, the black with the 2 burners.
Yeah,
So there's a grill top and an oven. Kids are baking pizzas out there and griddle for tortillas and stuff. So it is a heck of an operation. And that's canopies and camp cooking.
so on that note, who covers you as far as insurance wise in case a kid gets burned while they're cooking?
We are insured.
Through,
Longview Insurance is who we work with, but I forget who who the actual company
yeah, I
is.
don't
but
need the
it's-
agent's name.
Yeah, so that's an expense, right? That's not really very fun to pay for. And, nobody wants to give you a grant to cover your insurance or, but yeah, that's an expense that we have. Our total budget is around 600,000 a year right now to do all the stuff. And most of it, because we're so lean, most of it is just the staff to do the work.
Okay.
How-
Thank
How
you.
did you get the number of the 600K?
Say that again.
What's behind the 600K? Is that actual out-of-pocket?
That's
Cash.
how many dollars we have to spend to do what we do.
So again, that's actual cash that gets spent.
What?
Some people say, well, we had 300 volunteer hours at
No, that's yeah.
real money.
Yeah, that's real money, yeah.
Okay.
And we just are limited, people donate here, we do fundraisers and stuff, and people are very generous, but there are limits there, and there are limits to grants, and we're just bumping up against those limits and trying to figure out how to keep the thing going, yeah.
So where do those funds come from now?
We just had a big fundraiser, big like farm to table dinner for 220 people. A couple weeks ago, that net was like 50,000, 55,000, I think we made that night. We do the online Give Big, Give More 24 thing you see all the nonprofits doing. That's like 60,000. Then there's just, sort of begging people for money.
That's local parents and businesses?
Yeah, a lot of local businesses and and then there's some grants, local, Healthcare Foundation, Price Foundation, J.H. Kelly, Jamie's Environmental. We have gotten some a couple times we've gotten federal USDA has a program called Farm to School. We've gotten some of those dollars. We're in one of those grants right now that's it was like 350,000 over 3 years. So that's helpful. But once that 3 years over, you're not necessarily going to get that grant again. So now you have that hole in your budget.
In In the interest of time, I
Yeah,
wanna
sorry.
Okay,
move on. Did you have another question?
I'm not sure that I understand where is the line that, where do you get too big? I mean, where are you gonna chop this off at? So that basically, if you keep going out and getting more and more funds, I see you just growing and growing this. And I don't see that, I do agree with the goodness of the program.
Yeah.
But I don't see that it running away with, now you need 300 to 500 volunteers, or you have that many. Are you gonna have to double that next year? I mean, where, at what point do you
I
say,
hear-
this is a program that is X number of hours and X number
Right.
of time, and you chop it off rather than trying to keep growing it bigger and bigger? If you got 160,000 square feet of growing space now, where's that gonna get to? What point is that too much?
Right. I think most of it, we've been growing and asking that question, and I feel like we're just sort of have arrived, at that square footage is not going to change. And we've cut our programs to where we're doing sort of what feels like, the lowest thing to do. We could cut the cooking program with middle schools. We cut that garden club. There's more cutting we could do, but we've already done a lot. But I feel like we're there. And yeah, I feel like we're at that point, and I feel like we are understaffed. So, garden coordinators, one person is in charge of doing this work at like 3 or 4 schools. And we could use another person, but we've been running at this level for a couple of years. So, and this proposal is not about growing anything. It's just about helping us keep the doors open, which is not, like I said, an attractive thing to fund.
Okay, thank you.
Thank you.
Yeah, I appreciate
Lorna,
those
do you-
questions.
I see you.
Yeah.
raised-
that's okay. Couple quick thoughts about the volunteers. Oh. So I've
Seat up twice now.
I've sat on local sports boards for youth sports, and I understand the issue of volunteers. There's, we might have 1,000 kids playing and it's run all on volunteers. And if a parent doesn't step up to coach, your child does not play. And that's the way it is. That's just, and so I guess I would say it's okay for you guys to say, you know what, parents, if you don't step up, this program's not going to be here for your kids, and I'm sorry. And I'm just thinking about the number of volunteers. There's 20 schools, is that what you said? 20, and if there's 300 volunteers, that's 15 volunteers per school on average. So I guess maybe I don't fully understand like what volunteers and how many volunteers it takes to run it. Or maybe volunteers are like, I'll volunteer 1 hour a month and that they're counted in that total. And maybe that's not a lot of input, but yeah, I guess I would just invite you to say it's okay. Like to say no, that and I get that it's a garden and I get that it would take
That's
more
the
work to
thing.
get it up and running again. I appreciate that. But if people aren't willing to step up, then their kids are going to miss out on that. So I guess in my view, it's okay to say that. I would just.
Yeah, we've heard that idea before, and it's interesting. We're doing, part of getting volunteers is not just like wishing you had volunteers. There's a lot of work showing up to, math bingo night or whatever all the school events, which we are doing, but we need to be doing more of, and we don't have the people power to do a lot of that. So it's like, we need more volunteers, but we're so strapped, we can't recruit, type of thing. But also we find that like a lot of parents, like a lot of our volunteer base is not parents of kids that are at that school. A lot of times they are working during the day when we're doing the stuff. And so a lot of times it's people that are retired or don't have kids at the school, or, just moved here from California and they like gardening and they, think this is important work and they think, so it's a real range and we have, and it's, like you said, it's so revolving. It's not like, okay, we got our volunteers, now we're set. Like they're always leaving. Yeah, so.
Is your
Appreciate that.
comment on the school gardens? Please go ahead.
So I got a lot of comments about this. And now everybody, for the sake of time, we'll skip to my conclusion. All right. So here's the thing. You're talking about 300 to 500 volunteers. Anybody up here, anybody that's done any kind of volunteer, try to recruit volunteers, that's impossible number. And I mean, it could go on, but I'm going to tell you this. I've been to these meetings for some years now. Everybody comes in there with their hand out and it's rainbows and unicorns all day long. But at the end, you always want tax money. It's all at the expense of us. You're asking for money from the public and you shouldn't be doing it. If this is a volunteer organization, it really works, it would work on its own. This doesn't belong in the schools for one thing, because, and this is the number one reason, our schools are failing the 3 R's, right? Reading, writing, and math. You can look up the OSPI report on any school in the state. They're all failing. Kids are at 20% in math. They ain't got time for this. They need to, it's like you say, they're teaching a bunch of other crap in school. This just is more. And, I can go on about gardening. You plant things in the spring, but that garden's got to be looked after during the summer. Who the hell looks after that? I see you maintain 20 gardens, but I don't envision any child showing up on a daily basis to clean their furrows, to water the plants, to pull the weeds. I just don't see that happening. At the end of the day, good, you're doing a good volunteer thing, stay a volunteer thing. You take this money, this is tax money. You're taking money from other people. You shouldn't do that.
This also about the,
So I'm not going to talk about funding. What I'm going to talk about is the expectation. Gardening is really a year-round effort for all of us, is that just harvesting and cooking is not the end of it. You have the residual products that either you throw it in the garbage can or a true gardener goes into the mulch beds. You have mulch beds to turn through the winter. You have other things to do. I was raised in Eastern Washington. You take the leaves that are out there. If you put leaves, a foot of leaves over the carrot beds, you can harvest carrots all year round out of there, along with the angleworms and things that gather there. That's a kid's experience to go in and see the angleworms in with the carrots, and you don't have to put the carrots in some cold storage, or it takes care of itself. So I'm just saying, I'm hoping that your program, part of it is the education of true recycling starts with using the biodegradable stuff and mulch beds, et cetera, et cetera, et cetera. So I know you got your prime times through the year, et cetera. So I'm just saying, I haven't read your program, but I'm hoping it's viewed as an education in year-round recycling as well as the harvesting.
Yeah, I appreciate that very much. And that's what we're doing right now. I was at 5 schools last week, and we get partnership with City of Longview. So we're getting truckloads of their leaves that come out of the parks, and we're doing this much leaves on top of the beds and all that stuff. And then about the time we're done putting gardens to bed, it's time to start pruning grapevines. In January, we've got 250 grapevines out there. Fruit trees are a lot to prune. We got 250 fruit trees out there. So yeah, I would.
March, your start's already.
Exactly. Yeah. Yeah. Winter is not a break. Yeah.
That's part of education.
Yeah.
There's more than you get out of that book.
Well, and I'd like to reinforce that you use math, you use biology, you use working with others. There's so many pieces of the educational curriculum that will be utilized in a garden program. I've seen it. I worked in the schools with Ian. He worked his butt off. I'm gonna use that word. He worked so hard and he's done it for so many years. He's proven to me that he can maintain a program and he knows how. And if he gets ready to quit, I am confident that he will provide someone that won't just be a government person, but that will be a caring person. And I can't see this program ending ever. It's a wonderful program. I saw kids out there laughing, being joyful, mental health issues were forgotten. And it was just, everybody was equal, and I loved it for diversity, equity, and inclusion. Thank you.
Actually, that reminds me of a couple of points. Ian mentioned how happy the kids are to be out there in the garden, and no question that that is something I can easily see, because a classroom is a mind, yeah. Numbing, 9 month, yeah, numbing. Anyhow, you got that. That's point number one. Point number two is something I alluded to with Ian just a little bit, is there's a difference between having a plantation, like 250 grapevines is closer to a plantation by my minimum standards. But I am also interested in the educational aspect of the technology, the science, the taxonomy. This plant is like this plant, why? And if you feed this plant phosphate, you'll get negative results. If you feed it nitrates, you'll get positive results. Those are all things that kids could learn in a program by osmosis, because they'll just fun little experiments, and they do play in something that is seasonal. So if you have a plantation, you do worry about a year-round thing. And I don't know what the emphasis is and what it should be. I'm just saying there's the absence of the other concept of there's a whole science behind that. You tell someone you're going to learn science today, and for some reason or other now they'll shut down. But if you tell them, what do you think? This vine is going to grow faster than this vine, and all of a sudden you got a contest on your hands, and they all learn. And anyhow.
Just real briefly to that and to the taxation is theft, fellow back there, just the idea that, you know, well, and we hear this with schools, like, you know, should we be taking the time where kids could be in their desks, you know, doing the math, doing the stuff that they need to do to pass, you know, to pass the tests, or should they be out in the garden? And is that time in the garden taking away from that academic learning? And what, you know, what we've seen and what, you know, what other studies have shown and people in the districts know is that having kids that are engaged in learning, they're excited, you know, they're the lights on, and, you know, so they come back into the classroom after being out in the garden, and they ask them to write, you know, about your 5 senses, you know, what did you experience? And because they have these rich experiences, the kids, you know, the teachers get great writing out of them. And you can do math and a lot of that stuff out there. So it's not really like in place of, you know, learning. It's that thing where the kids are doing what they're doing, and they're learning all kinds of new language, also vocabulary. There's a lot of vocabulary out there. So anyways, it's not either or.
Ian, I'm curious, how often does each class visit the garden? Like an average 4th grade class? Are they there once a week, once a month?
Yeah, so we, you know, if schools wait for us to come around, it's not that often. You know, we're lucky to get to an elementary school, you know, or to one class like 5 times in a year. But what we're doing is we're handing off, you know, homework. You know, here's your garden homework. The teacher's out there with us. So we're basically training the teachers. And so once we leave, then the teachers are coming back out there, checking, you know, how are the peas that we planted, how are they growing? They're doing that stuff. They know how to smell the rosemary and taste the kale, and they know how to, you know, they're learning more about the garden. But that is not a set thing. That depends on school climate, that depends on the principal, that depends on individual teachers, priorities, workloads, like all that stuff. So I actually don't have that number, but.
Do you have maybe just an estimate? I mean, just given, I used to work in the schools.
Yeah.
I get what's put on a teacher's plate.
Yeah, exactly.
What, on average, like, and maybe you don't even know that, how many teachers follow up and are taking their kids out beyond the 5 times that you might see a class in a year? Do you have an idea? I know that's a big question.
That is a big question. And I think it, most is a good thing, but part of that is about, you know, our staff, like which we're dialing in as a staff. We're dialing in methods and materials, lesson plans, et cetera, for teachers to be able to sort of make it easy, drop those barriers, make it easier for them. But I'm sorry, I don't.
I just have
I'd
one
like,
little comment, one thing, that this proposal is asking for $150,000. And when we first started talking about it on the spreadsheet that Gina provided, and I know it was just, you just plugged in some numbers, it was 50,000. So I just want to say to the board that, that's, you could change the numbers there. Just want to point that out.
thank you. I think you made a very good case. I would have loved to have a program like that when I was a kid. I was a gifted kid who was always bored in school. The chance to go out and be invigorated, go out, get some fresh air, do something productive, learn about things that I'm actually going to remember. These kids are going to remember how to do this, how to be self-sustaining. Because one of the things that we don't teach enough is how to take care of yourself, how to provide for yourself intelligently. And this is a way to do that. And I absolutely think it's a wonderful program. You've made a very good case, and I hope you go forward. I don't see a problem. And the fact that the curriculum is failing has to do with the way the structure of the school is, not the garden programs. You can't blame the garden program for failing kids. We have to restructure that also. Thank you.
Thank you. And just for clarification, I don't remember if it was Commissioner Mortensen or Commissioner Weber who mentioned that a pilot, or maybe you, that you said the pilot program would make it more, that it would not be something renewing every year? Is that what I heard right?
A pilot program would be a proof of concept, but as I mentioned earlier, I don't think there's anybody here who thinks the concept is unproven.
Gotcha.
So I think
I remember.
happy there. A question I would ask is, school used to have a shop, home ec, band, and all those things I think are no longer available typically, at least not inclusive. If it exists, it gets extra money from
Less
the parents.
and less, yeah. Yeah, especially at the lower grades. I mean, high schoolers have, the high schools around here have ag programs, in a greenhouse and that sort of stuff. But before that, a lot of that stuff is, not there.
Yeah. So I think that ties into maybe a picture that says, why aren't the schools your best pals here? And they are, as long as it doesn't cost them a dime. They are, as long as it doesn't cost them any time. And that's really cheap of them. And so they fail at the 3 Rs. They don't succeed at anything. The only success is what you're presenting.
So let's do one more comment if it's related to the garden. Oh,
It is. My question is, right now you're asking for 150,000, and I think all of us agree that this is a wonderful program. And right now you're asking for 150,000, but your yearly budget is 600,000. So as costs increase and grants dry up, what is to stop the county commissioners for being responsible for this program into the 500,000, the 750,000 that it's ultimately going to become? And so is there a succession plan in place to cover these costs without coming to the county for all of it? Because eventually I see the county going to be responsible for all of it if the program is going to continue in the long run.
that's a very good point.
Well, and from the county's perspective, the board will decide how much and how often. So we'll have a contract amount if that's approved, with a set funding amount up to $150,000, for example. If there is an ask in the future, the commissioners will have to make a decision at that point of, do we want to award additional funding or stay with this funding or not contract at all? So And that's kind of ties into the time frame of the contract we were talking about earlier. We often do a one-year contract so that those conversations can be had where we're revisiting the contract and the funding and the amount and all of those points before a decision is made about a new contract.
Well, thank you. It's a tall order, I know, and I admire your work for sure.
Okay, we'll have one more comment on this and.
I'll make it really quick.
Sure.
Okay, there is one avenue of revenue that you might not have checked out, and that is the homeschool children. Now, they are very well organized, and if you do need help getting in contact with certain representatives of those groups, I can help you on that. I know Gina has my phone number and stuff, so if you would like, because I do know that, believe it or not, the numbers of homeschoolers have really increased. There's a huge amount of children and they have money, so.
I appreciate that. We do do outreach with homeschool families, and a lot of those folks, especially during the summer, will come, our community, each garden is open every week for community days, and that's when we see homeschool families, that's the main thing that we have them come to. But yeah, that's good.
Okay, in the interest of time, is anybody ready to make any kind of a motion or proposal? If not, I think it looks like everybody's thinking about it.
You're asking for
No,
the
not
board to make a recommendation to the Board of Commissioners.
not yet, just
Okay.
wanting to either move on and let it marinate a little bit, or
Okay, I'm going to be brave here. I think that overwhelmingly, there's been support for the community gardens. There's uncertainty about the funding. I would like to recommend that we consider funding for 1 year, the $150,000 request.
okay. Motion on the floor is to accept this proposal as it is written. Have a little discussion on that.
I do have some ideas for metrics, if anybody wants those ideas.
Yeah, I think it does need to have some metrics. I had wrote a note that they should have some kind of report every quarter or twice a year, something like that. I'd also say that well, that's all I'd say.
One question for Gina, is there anything in the foundational health contract that would put any stipulations on how they do anything that would change how they fundamentally, that you're aware of?
No, we have to report what we spend the funding on, but there's that funding can fund such a variety of things. They wouldn't come back and say, oh, you're doing school gardens, it has to be done this way. I don't see that happening at all.
Okay.
Question for you, Gina. Is that the bucket of funds that we have not spent in its entirety in previous years?
Correct. Yep.
Yeah. Those are the ones they like to beat us up over, that we've returned to the state.
Yeah, and one of the reasons, there are lots of reasons we don't spend it. One of the reasons I don't is because I don't want to aggravate the problem. But in this case, I may argue in favor of doing it just because it is, at least today, it will not aggravate the problem. But it's going to put a burden on Ian to heed what we've said about losing the program. And I think there's a big danger of that. And I think anyhow, I'll stop there.
Yeah. Well, I share that because we've talked about that on some others too, that we don't want we don't want our involvement to fundamentally change what they're doing, which is working. And we've talked about that on other programs too. So I would second that with Commissioner Mortensen, that really take heed of that we're not asking you to change. We want you
We're asking you not to change.
to, yeah.
And the foundational, mental health does start early. And as much as I think the system is not conducive, like I said, in classroom, a smart kid is going to go crazy. It's going to be, I don't know how they can handle it anymore. I took my kids out of, in K through 12, they went to many different schools. I'd sit in a classroom and say, okay, we're done here. And we go to another school. But I can't think of another program where we would spend those mental health dollars and get as much of a payoff.
No, I totally agree.
Well, should we put it up for a vote? Okay, motion on the floor from Karen is to accept this proposal for $150,000 as would be a recommendation to the commissioners to approve that. That'll be back to you. And well, let's take a vote. All in favor? Say aye.
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 Opposed? Abstentions? Okay, Commissioner Morton says abstains, and I guess the motion carries. Okay, congratulations. Let's keep it. I think it's really is
Thank you.
important to heed what the commissioners have said and don't make this into a government program.
Yeah, yeah. Wow, that's wonderful. Thank you so much. And I will say that is when we're trying to get funding, what's difficult is when it does come with a lot of strings, and then we have to spend a certain amount of the money and effort just sort of paying those obligations. And we're there every day. We know what needs to be done, and just being able to say, spend this to help where you need it most. That's the best. So we're really grateful.
I do need to repeat, and this isn't the end. It's got to go to the board, and they may up it, they may lower it, they may just
Good point.
throw it out.
Good point.
Yeah. Yep.
I'd like to make a quick comment.
Quick comment.
I just want to, as a member of the public, thank you for your patience. It was quite a grilling, and you were very gracious about it. Appreciated that. You got a lot of information.
Thank you. Okay, we're going to move on to the next item on the agenda. Just a brief, I'm just going to give an update. We had a problem with water. Arsenic was in the water, is still in the water, and the public had brought this up to the board. We had discussed it a couple months ago, and I'd just like to say that thank HHS, Gina and Carol, for updating our website. So the website on the water section has been updated. And so there are links that you can go find to test your water. And I'd just like to say that the board has responded and fairly quickly. It only took us a couple months, which is pretty quick for government.
Careful now.
So that's that part. And then, did you have a question on the water?
I do.
Yes.
I'm Kathy Cochran. I am the person who has been really pushing for public awareness of the arsenic in the groundwater in the Toutle area. And I was unable to come to last month's meeting where I'd asked you to consider the state grant for the alternative drinking water program. I have metastatic cancer. I had a medical appointment, couldn't be here. But I did, and metastatic cancer means that it's all through my body and there's no cure. I did listen to your meeting, and I heard several items pop up that I'd like to try to correct, but it might take me a few minutes. So the first thing I heard, I'll just run through briefly what I heard and what I'd like to address. The first one was, Mr. Chair, you don't know who I am, and I'd like to tell you who I am and why this is important to me. The next one is, why hadn't you heard about this before? You've just heard about it in the last couple months, and it goes into the history of the arsenic, what we knew about arsenic, and what we didn't know for a long time. There were also some misconceptions that I heard about what the state's new grant program is, and what the research is. There's a researcher right now that's showing, he's got some preliminary results that are interesting about where arsenic might be located. And what I heard was that some misconceptions about what he's preliminarily finding. And then I also heard some misconceptions about how our community in Toutle might use the program. So that's quite a laundry list.
Just in the interest of time, we need to keep it concise because we've already gone past our time.
Oh, okay. So maybe I could come back, but I'll
Please.
start with who I am. I also want to say, because of my health, this takes a great deal of effort for me to be here. And I just like that to be recognized. Our arsenic was discovered in 2021 at 640 parts per billion. The EPA maximum level for protecting public health is 10 parts per billion. And my doctors didn't know that before I got cancer. And when I told them that, they said, well, we don't know why you have cancer, but it's kind of hard to imagine that didn't play a part in it, and probably a significant part. That was in 2021. I came to the board then. I felt it was my duty to let the county know about this hazard. It also ended up, all my neighbors tested for arsenic and found that it was prevalent in my entire neighborhood. Everybody's was high, but we'd lived there the longest, so we were the most exposed. And so I did come to the county then. I was asking, I had extensive conversations with your environmental health unit. It was season-long at the time. She was very helpful. I asked at that time, I was interested in a public health standard for it because that would have protected my husband and me. We didn't know that arsenic could be in the water, and we hadn't tested for it because there wasn't any information about it on your website. My husband was following the directives of your health department when we had our water drilled, and it just called for E. coli. It's so at that meeting, you decided to just go for communication and not for a public health standard. The problem with communication, and I'm all for communication, but it's got to be consistent over time, and people have to find out about it. 3 years later, people still don't know about it out there. They don't go to your website. So I'm here because I felt like I wasn't listened to in that meeting. I'm here because, not because it can save me. It's too late for me. I don't want anybody else to be standing in my shoes. And that's my main reason for wanting to get more information out there. I did public records requests to find out what the county knew and when. I did a lot of research into what arsenic is and what it can do to your body. We contacted a geologist from Central Washington University to come out and look at our property and help us figure out why do we have arsenic, and maybe other areas in other places in our area don't. And she helped us figure that out too. And I have a lot of, so I have a lot of background that I could give you, but that's why I'm here. I don't want to be forgotten. I don't want to have this issue go away until we get a better communication plan, a better outreach. And I also would like to see a reconsideration of the grant program the state's offering that could help people get testing and screens in place in our area. So I can see my time is up.
I think that what the board is, our approach has been to get the information out, and they did update the website now, and so you can, please do take a look at it. And then I'm wondering if maybe Gina, you could add a water part to the quarterly updates, maybe if there's any kind of spike or any new news on it. Would that be possible?
Spike or new news around?
Water, arsenic, or just water, the quality of the water?
Well, we, as she mentioned, we required testing for bacteria, but not arsenic. So we wouldn't be able to report back on.
No, well, oh, good point.
Yeah.
Well,
I'd like to come back and talk next meeting, maybe about the alternative drinking water program that is available, where you could get some more information, and about the testing that's gone on, that what we do know.
okay, thank you.
Thank you.
Thank you very much. So you're the one, you wrote the email to us.
I wrote both those emails. I also
Okay,
was the one behind the news articles that have been published so far.
thank you very much for that. Thanks for raising the awareness. Okay, moving on to a quarterly report. HHS has made a presentation for us, and I see Dr. Krager is not here, so I guess Gina.
He's participating via Zoom. I did just want to, I know we're past our time, so I wanted to just offer if we wanted to move our presentation to the next meeting, we're happy to do that. I just wanted to throw that out there because I know we're past time already. But we're happy to continue. Dr. Krager, I see, is on via Zoom for his presentation. So whatever the board would like to do.
How long is the presentation?
I can keep it brief. It's only like 6 slides, so it shouldn't take.
Yeah, let's go ahead, Dr. Krager.
Okay.
Thank you for joining us.
Yeah, of course. Yeah, I apologize. I'm not there in person.
No, that's okay. I'm glad to see your face here. That's great.
It is weird. I can see it behind you all, and it looks very large. Anyway, if we could get the slides, that would be great. So yeah, my name is Dr. Steve Krager. I'm the health officer for Cowlitz County. Before I forget, I want to wish you all, happy Thanksgiving week, and hope you all have a good one. Let's go. Okay, so we across the state, as well as in Cowlitz County, we've been seeing an increase in pertussis, which is also known as whooping cough. I'm going to give you a brief background on it, what it is, really shortly touch on some data, and then kind of what we are asking from ourselves as well as the community and you all. So let's just get into it. Let's go to the next slide. So pertussis, I'm just going to call it pertussis, highly contagious bacterial respiratory disease. The name of the bacteria is called Bordetella pertussis. That's where the name comes from. It's spread, mostly when people cough, and unfortunately, it can cause a pretty severe cough. If just stories about people who've had pertussis, sometimes you cough so hard you throw up. It causes, sometimes the whooping comes from you're coughing so hard that then you have to take in like a really deep breath, and especially in young children, that can sound like a whoop. It's most infectious that first 2 weeks. If you are able to get diagnosed and on treatment, we can reduce that infectiousness. So most people do okay. Obviously, it's not a fun illness to have, but our biggest concern is for young babies, so younger than 12 months. somewhere around a third end up needing treatment in a hospital. So it's really hard for their little lungs to handle this bacteria. Even if they need hospitalization, again, most babies do okay. Very rarely it does cause death. So those are the things, we're most concerned about, obviously hospitalization, really severe illness in the youngest and most vulnerable among us. Those with immunosuppression are also, at risk for more complicated disease. Okay, I'm gonna go over just briefly data. Let's go to the next slide. So just the last 6 years or so, we are actually doing okay. If we were, compared to like 2018, 2019, we're right about where we were in terms of number of cases. It's just that we haven't had very many the last few years. I will say pertussis, so if you look at our counts, 63 in 2018 and 37 so far in 2024, I think that number is going to go up before the end of the year, but so we'll probably end up below that, 63. We do have a slightly higher rate than, in fact, it's about twice the state average right now. Although it really depends on where you're at in the state, to be honest. So Clark County and us have the highest rates right now. Clark County has a higher rate than we do. They're seeing a lot of pertussis, and they're probably the main driver behind this increase in the state. Although we're, obviously we have people who kind of go back and forth between our counties, and I imagine that's probably where some of our cases have come from. Let's go to the next slide. Oh yeah, so we're at 2 times the state. Again, it's, I will give lots of caveats to this data. We know we're missing cases, right? Not everyone who has pertussis is getting tested, and we're really only catching the ones that are tested and reported to us. Let's go to the next slide. So I had to suppress some of these numbers because they're under 10, and we have to be careful with that to not identify people. But this is just looking at age breakdown. So, and this is a little bit unique to Cowlitz County. I think it's kind of interesting. Most of our cases are in our high school age kids. So we've been working really closely with our schools because unfortunately, especially if you have a kid in a high school, you may have gotten an email about an exposure that happened, right? That's where we're seeing the majority of our cases. And you can see that those gray bars are the rate among the state, and then the red bars are Cowlitz County, and we just have a lot higher rate in our high school rates. In the state, the highest rate is actually among kids under 1. We thankfully haven't had a huge number, although we have had some. So let's go to the next slide. I know we're, and this is pretty much it. So the main message I want to, for the general public, the main message I want to get across is think about getting tested. So any young baby with a persistent cough, it might be pertussis, and maybe you can catch it early enough and prevent, get treatment started, and we can prevent a more severe illness. And then I really do want adults and adolescents to get tested too. And especially, if you've had a persistent cough that's lasting longer than 7 days, I know it's tough because a lot of even just common colds can sometimes do that, right? But if you're noticing, gagging, vomiting, or even some of that whooping because you're having these coughing fits, really consider getting tested. And especially, if you're going to be around, if you're around people who are more vulnerable, pregnant women, and then, young infants. And then, obviously we want people to stay up to date on vaccines. So you get young kids get something called DTaP. And then as you get older, teens and adults get Tdap. So that includes tetanus, diphtheria, and then pertussis. So if you're around like a young infant, it might be the right time, to get a booster. Tdap generally is recommended, often just when you need your tetanus booster, which is about every 10 years. But we also just, anyone who's going to be around someone more vulnerable, like a really young infant, I do think it's a really good idea. Respiratory hygiene, we've talked about that a lot, trying to cover coughs, washing hands, that sort of thing. Our work in public health kind of has stayed the same, which is contact tracing, trying to, figure out where someone got infected and who they may have exposed while they were sick. and then antibiotic recommendations. So one of the tools we have to slow the spread is antibiotics. It really does reduce your infectiousness. So if you do end up having pertussis, we generally recommend a 5-day course of antibiotics, and then we consider you not infectious anymore. You can go to school, you can go to work, that sort of thing. And then if you're around if you have pertussis and you're exposed to someone, especially if they're higher risk, we might recommend antibiotics for those people, even if they don't have pertussis, kind of as a prophylaxis, right? A preventive course of antibiotics. And we also recommend that for household members just because it spreads so easily within a household. Okay. I think that's the end of my slide. I want to say thanks to Shannon for grabbing that data for me, Shannon Hopkins, the epidemiologist we work with sometimes. And then I'm going to see if we have any questions. I know that was fast, but that's it.
That was very good, Dr. Krieger. Thank you.
Yeah.
Is the croup, is that pertussis?
It's a great question because there are similarities, but it is a different disease. So croup, croup is usually caused by a virus, and actually it can be caused by a few different viruses. But usually more kids under six get croup, and you'll hear it described as a barking cough, and it really does kind of sound like a seal barking. And that's croup, and it can cause severe illness, but less likely than pertussis. Unfortunately, we don't have a good well, we have treatment. We don't have like an antiviral that works, but sometimes we'll give kids like an inhaler or a bit of a steroid, like prednisone, to kind of reduce inflammation, and that can help their breathing a little bit. So that's a great question.
Thank you.
Dr. Krieger, this is interesting information, and I'm curious as to whether the numbers of teenagers is, if you have the level of data to know whether it's predominantly in the Woodland area closest to Clark County, or is it, you didn't provide the information.
Right.
But, I mean, I wouldn't be surprised, but I don't know if the data reflects that.
So I have to look at it a little more closely, but from what I remember, it's honestly in all of our high schools. And I say that, I shouldn't say all of them. It's been more than just Woodland that we've seen cases in. Yeah. So, and again, like, adolescents and teenagers usually do okay, right? And so it's not always like the highest priority, go to a doctor if you just have a cough. But again, it's kind of something, we want to prevent that spread to our more vulnerable. So we do hope that people, get tested and treated. Yeah.
Thanks.
Okay, thank you very much, Dr. Krieger. That's excellent. Bad news, but excellent presentation.
Thank you all. Yep.
Okay, we're coming to the end here. The Board of Health meeting, the next meeting is on the calendar anyways for New Year's Eve. And so I've went ahead and canceled that unless there's any objections to that. So, so this will be our last meeting. And I'd just like to say that I wish Commissioner Mortensen and Commissioner Weber the best of luck on your new ventures and pursuits next year. It's been enjoyable to work with you, and thank you for keeping this novices here like me and well, helping us keep healthy. Did you have some more comment on the public comments?
I'd like to make a brief one, yeah.
Okay, we'll open it up for public comment.
Open it up so I can read it. It's prepared. Okay. Thanks for your patience while I set up here. Just take a moment. That.
I'd just like to
And-
thank everybody for their patience. This meeting went a little bit longer than we thought.
And I
but-
would like to put these on the record with, as well as the supplementary information that went back to what I'm saying that I sent to the board earlier. Thank you very much. And I would love to bury the resolution problem we had, but it seems like people in the community want to keep digging it up and making insults towards the board about some of the things they did, and I just bringing in some information. And I call this why the Board of Health is vindicated and what can be done. And this is opening as peer-reviewed studies reveal that mRNA therapeutics should be pulled. Multiple lawsuits have successfully shown that the mandates were illegal as the experimental mRNA injections cannot be called vaccines and must be called therapeutics for the Ninth Circuit Court. And because of that, numerous lawsuits have already gone around the country where $1 million settlements have happened of people that were fired for not taking it or took it and were damaged. And what we did by fighting to have earlier to have the county not force it on their employees, we saved the county lawsuits, so we should be thanked for that, not vilified. And here we go, here's my comments. Only 40% of the public trust the medical community now. That distrust is deserved. The so-called experts were wrong, and that was catastrophic for millions of people. A 2023 survey by Johns Hopkins University, that's Johns Hopkins, found that around 750,000 medical errors resulting in deaths. There were 1.1 million doctors in the US. Contemplate that as an average. COVID dissidents were called conspiracy theorists, grandma killers, and worse, yet we were vindicated in all measures. If your doctor suggested you take the mRNA, they were lying if they reassured you it was safe. No research was done to establish it. Anyone saying something otherwise is either ignorant or lying. Seattle, the most vaxxed city in the US at 98%, has had a 1,200% spike in heart attack deaths since 2021, and that has been attributed to epidemiological studies to the vaccine because they're hyper-vaccinated. The Medical Freedom Resolution is a salvo that we will not blindly comply to coercion, fear-mongering, or relentless propaganda. Show us data, open the books. New scientific data is always emerging and always disputed and reviewed. You don't follow the science, you follow the best data. Now, even the NIH admits that fluoride causes cancer, reduces IQ in children, and does nothing of note for your teeth. That's the newest research, and it came out of the NIH. So think about that. Many municipalities and nations are halting its use. We need to open that debate here. Lastly, what do the critics of the current BOH expect them to do? People have free will. They have been told overeating is unhealthy, smoking can kill you, drugs are addicting and can ruin your life, and still people persist. We can only recommend and advise, often to dead ears. We need to invest in mental health. The mental health crisis is a threat to the community. It seems those in Olympia have thrown our most vulnerable, our most dangerous onto our streets and left localities with that burden. We need new and bold strategies to cope with it. The state is now $10 billion in deficits over wasteful products and fiscal abuse. A local, regional inpatient mental health and addiction facility is badly needed for adults and juveniles. We need to discuss this as a community, like what are our options? And I say thank you for the time. And the next time I'm going to be bringing up the falsity of statins and how bad of a problem they have become with the new research and other things. So thank you for your time, but this is on the record.
Thank you for your comments. Sure.
I just have a quick question, if I could, about the water quality testing. I'm wondering who sets those guidelines? Is it set on the state or federal level? And how are they decided to be adopted or not adopted? Do you have somebody can you direct me to somebody that I could talk in depth with that on?
Environmental health. Yeah. I would, yeah, Carol and Gina, do you want to address that?
Or maybe I can just set an appointment with her and talk with her in person and not tie up any more of your time. Is that okay? Yeah, I'd be really appreciate that. Thank you.
Thank you for your comments. Okay, with that, sorry we went a little late. And again, Commissioner Weber and Commissioner Mortensen, wish you good luck. We'll miss you. And I wish everybody a happy Thanksgiving, good health, and a happy new year to everybody. Thank you. We'll adjourn this meeting at 11:31.